Namaste.
Namaste.
Namaste, Michael.
Namaste, Dr. Reddy.
This is Michael Pitt, came from London with knee arthritis. He was having problems, especially pain on walking and a little limping. He came and we saw him, took x-rays, his knee bad enough to have a knee replacement. He had a knee replacement 2 weeks ago. Today we took the sutures out. We just joking that in the past we used to go to London for treatment. Now Londoners are coming. London mayor is Indian and probably Prime Minister could be Rishi. Yes. So probably we're going to take over.
There you go. Perfect irony. End of empire.
Absolutely, absolutely. So, Michael, could you tell us in your way what made you to come to India, choose Apollo Hospital, and of course in Hyderabad?
Okay, good question. Unfortunately, in my country, the National Health Service, which is a great health service, is facing many challenges. And I've been living and working abroad for many years because I work in international development. And when I went back to UK, it seemed like to get what I need, basically a new knee, could take anything between 12 to 18 months. That is the situation in our country at the moment.
Yeah.
So I began researching possible options for this, affordable options, because private hospital care in UK is very expensive. My family doctor suggested India. He's also Indian. So actually, to be frank, I looked at both India and Turkey to start with. I dropped Turkey partly through cost and partly through language, but there's a lot of growing medical tourism in Turkey too. I have been to India before, and I started searching on the internet, and I discovered Apollo hospitals. I kind of searched lots of hospitals, and it's a multi-speciality hospital. It has advanced surgical, what should I call it? Surgical technologies. And I decided on Hyderabad. I'm not really sure why. I looked at Delhi, I think I looked at the others, but it seemed Hyderabad had very good reviews, especially around orthopedics. And then, short little story, actually on the plane here, I changed in Muscat, Oman, and on the second leg, my co-passenger asked me what I was doing. He was Indian, and I told him I was coming to Apollo Hospital, and he said, "Oh, Dr. Reddy, KJ Reddy." This was, I think, a Dr. Ravindra, I'm not sure.
Yeah, probably.
So this is
There's so many Ravindras in Hyderabad.
Yeah, this is how I ended up here.
Yeah.
So right from the minute I got off the plane in Hyderabad, I was met by the Apollo team. They got me through all the immigration amazingly fast, took me to the hotel, and day 2 I met Dr. Reddy, and we started off the process. So no waits for 15 months, x-rays were taken, consultation. I knew what the problem was basically, but it had to be confirmed. Both knees are problematic. We discussed the options, what's possible, booked a date, time, met with the anesthetics team, and everything has been very smooth. I mean, I would like to say the communication has been very good, because that's important, especially for a foreigner. I've experienced no problems in the hospital. Dr. Reddy explained the process, what he was going to do. The worst part was the noise of the operation. He's drilling my leg off.
Probably we could have given you headphones.
That
but I
might
think
be.
Probably,
Yeah, anyway,
yes.
it's not,
Maybe next time.
it's a
next
short,
time.
short operation.
Yeah,
I was 3 nights in the hospital altogether, 1 night before,
yeah,
and then transferred back into the hotel.
yeah.
And I've been having physio twice a day, which has been very, very good too. And then the Apollo home care team.
Yeah.
Some glitches, but once everything was sorted out, and it's been a good experience. Some pain, but I think that's part of the process.
Can't get rid of pain completely yet.
And I kind of feel optimistic. I mean, first week was quite difficult, but now I'm walking, as you can see on the video. I'm a bit wobbly, but it's coming. And I've been very, very satisfied with the care I received at Apollo.
Thank you. That's really grateful. And what about your left knee? We did something for the left knee.
The right knee.
Oh, sorry,
Right knee.
Right knee.
I unfortunately have arthritis in the right knee.
But not bad enough.
Right. So Dr. Reddy suggested an injection. Because of the problems with the left knee, I've been putting more pressure on the right knee. So we will see how the injection I just received today, I can't pronounce it, hyperuronic.
It's a Synvisc 1.
Okay.
That's it.
Okay.
Hyaluronic acid,
Yeah,
but
yeah.
Synvisc 1. Yes.
So we'll see how that works out, hopefully. Otherwise, you may see me again for number 2.
Probably not in near future, but
We
maybe,
hope not.
maybe.
But yeah, I would not hesitate to come, frankly.
Thank you.
So,
That's
yeah.
wonderful. That's
Yeah.
wonderful. So, as I said in the past, about maybe, I would say about 30-40 years ago, most of the Indians used to come to London for knee replacements.
Right.
I was there about nearly 12 years in 90s. And I received quite a few from here. We used to operate on them. So I think probably I feel we are in par with London. And I was working for the NHS as a consultant, heading the lower limb knee unit. It wasn't too bad. My waiting list was about 9 to 12 months.
So still long.
Still long, but I think
Better.
probably. But as you can see in India, not much of waiting list. But as we were discussing, unfortunately, probably 20% of the population or people suffering from the knee pain would have access to this kind of treatment, unfortunately. And of course, our Indian government is working very hard to improve those things and get this treatment to everyone. And currently, I understand about how many? 70 million people are suffering with knee pain and probably need some form of surgical intervention. Some of them may be knee replacement. So I think that's the story of India. But what do you think? The food, India, Hyderabad, did you taste biryani, Hyderabad biryani?
I've had biryani.
Yeah. You like it?
Yeah, it's good. I like Indian food.
Yeah.
No problem for me.
Very good, very good. And as you rightly said, I think most of the people prefer India because there is not much of language barrier.
Language, and there is that connection between
Yes,
the
of
two
course.
countries.
Yes,
Good and bad.
but we still feel
there
we are good friends.
Yes.
Good friends at the end of the day. So I think yes, I think.
But language certainly is the main.
Yeah.
I think.
Yes, definitely. Because wherever we go, I think they speak our language. And as you know, right now, I think the good thing Britishers have done to India is united people with common language. Otherwise, India had so many languages.
Yeah, 100 and something more.
Yeah, so many languages.
Yeah, it's true.
So I think it's a pleasure treating you,
Thank
looking
you.
after you. I was telling you are excellent patient. We don't mind patients like you.
Okay.
More
discount next time.
Probably yes.
Okay.
We'll give more look after. I think it's a pleasure looking after you because we also feel very proud to look after people from London because we always look up for London.
Real London. Proper London.
Proper London, yes.
Okay.
And Apollo Home Care, I think, is very
important
because it's not only, unlike in UK, I mean, we don't get that much support apart from home care. So, so you happy with home care?
Very happy.
Yeah, we have excellent
She's a
team.
saint.
Excellent
Ramana.
team, excellent.
Yeah.
And physiotherapist?
Physiotherapist is excellent.
Excellent,
And
yeah.
he's-
Very
he's
good.
Ongoing. So
Very good, very good.
he
And
puts me through it.
Yeah.
But yeah,
and probably going to leave Hyderabad in about a couple of weeks.
yeah, that's the plan.
But end of the day, I think what happens is nowadays, follow-up is not a big deal
Yeah.
wherever you are, because
Yeah.
we have 24/7
Yeah.
app where I can do video consultation, or video consultation has become
Yeah.
very common.
Yes, it's common.
So you can consult me when you go back there, and if you get an X-rays, we can
Yeah, okay.
see those things. So previously that was a problem. Once we operate, follow-up was a big problem, but we are able to do video consultation and do follow-up.
Excellent.
So not to worry about that. Not to worry about that. Hopefully you shouldn't have any problems. But in case you need any advice,
Reassuring.
we are there for you.
Yeah,
We are there.
Thomas,
And
of course,
yeah, and probably very soon we might start clinics operating in UK. So
The
I might
invasion is coming.
probably I might visit because we Apollo have a what is that university, Buckingham University, and Crewe Hospital. So probably we would like to start there very soon.
Okay.
So thank you very much.
Thank you.
Namaste once again.
Namaste, sir. It's been a
Take care.
pleasure.
We will see you once again.
Thank you, sir. Thank you.
Namaste.
Namaste.